This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
Health Broadcasting Service, HBS Radio. HBS Radio is who you're looking for.
Weekly news update coming to you from the Health Broadcasting Service HBS radio channel. Africa vaccine manufacturing drive is for long term, says CDC. Africa's efforts to build up capacity to manufacture vaccines against COVID-19 are not designed to meet this year's needs but are for the longer term. The head of the continent's top public health agency said on Thursday. The efforts that are going on the continent now as part of the African Partnership for Vaccine Manufacturing are going very well. There are about 10 countries that are engaged now in the process of vaccine manufacturing or planning to do so, said John Kingeson, director of the Africa Centers for Disease Control and Prevention. The CDC, he said the leading countries involved were South Africa, Senegal, Rwanda, Algeria, and Morocco. However, that is not designed to meet the needs for this year, for sure. It's designed with the understanding that we have to find a long-term solution for vaccination in Africa. It's also designed with the understanding that we may be immunizing ourselves almost every 6 months on the continent with this virus. Africa transitioning out of pandemic phase of COVID, says the World Health Organization. Africa is transitioning out of the pandemic phase of the COVID-19 outbreak and moving towards a situation where it will be managing the virus over the long term, the head of the World Health Organization on the continent said on Thursday. I believe that we are transitioning from the pandemic phase and we will now need to manage the presence of this virus in the long term. Dr. Matshidiso Modi told our regular online media briefing. The pandemic is moving into a different phase. We think that we're moving now, especially with the vaccination expected to increase, into what might become a kind of endemic living with the virus, she said. Africa's COVID response improving, vaccinations lag. The World Health Organization says Africa's response to the COVID-19 pandemic has improved over time, but the continent needs to accelerate the pace of vaccination to control the pandemic. The head of the World Health Organization's Africa division said on Thursday, "We are finally able to say that if the current trends hold, there is light at the end of the tunnel, as long as we remain vigilant and we act intensively, particularly on vaccination. The continent is on track for controlling the pandemic," said Dr. Matshidiso Modi, the World Health Organization Regional Director for Africa. She said the response had become more effective with each new wave of the virus, noting that the first wave had lasted 29 weeks, while the fourth was over in 6 weeks. However, Modi said 85% of Africans had yet to receive a single dose of vaccine, and uptake needed to be significantly accelerated. A steady supply of doses is now reaching our shores, so the focus needs to be on translating those into actual shots in people's arms, she said. Connect with us on our Facebook platform at Health Broadcast and our website at www.healthbroadcastingservice.com. And please remember to press the subscribe button to stay abreast of vital and authentic health developments from around the globe delivered to you by the Health Broadcasting Service on YouTube channel. We will bring you more updates as more reports come in. Stay safe and remain healthy.
This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
Health Broadcasting Service.